So we have to set our Panorex machine to the right height to get our patient in. So if we have to raise or lower it, we're going to press this button and push up or pull down, whichever we need. So we're going to ask our patient to step forward, and we're going to ask our patient to put her hands on the handles and hold on. Then I'm going to line this up at about the right height for her to bite on the bite stick. Now we're going to instruct our patient that there's little ridges on the bite stick at the front of the stick, and she's going to bite her upper and lower teeth onto the bite stick. We're then going to instruct our patient to step their feet forward a bit. We're going to put our foot about 12 inches from the base and get our patient to step their feet forward. So when we look at our patient from the side, they're kind of standing on an angle for us. So now that we have our patient standing inside of the Panorex machine at the right angle and the right height, we're now going to set up all of the right measurements for the head. So step number 7 talks about the midline. If we look on the control panel, we notice this little button. This is for the light, and when I press this button, it turns the lights on in the Panorex machine. So this first step that we're looking at the light or the line that goes through the middle of the forehead and down the patient's nose. If it isn't straight, that it's right down the midline of our patient, we're going to ask the patient to tilt their head or move their head to get that line straight. What we're also going to do at this point is we're going to just touch the back of our patient's head and ask them to tip their chin down. When we tip their chin down, it actually lengthens the spine and it gets our patient standing nice and straight and tall. So that's step number 7. The next step is number 8. Step number 8 is getting our Frankfurt plane straight. The Frankfurt plane is a line that goes from the bottom of the orbital socket to the tragus, the top of the tragus. The tragus is the little bump in the ear. So we're going to line our patient up and we're going to show them. But on the wall over here, we have a sign that actually helps you to line up that Frankfurt plane that goes from the bottom of the orbital socket over to the top of the tragus. Some people line it up the bottom of the ear and the lip. I find it easier to use this line. Some of your other facilitators may instruct you otherwise. This little dial here is what will move the line on my patient's face. So we're going to take a look at our patient. The line, we want it to go from the bottom of the orbital socket, so you might have to touch your patient's face, let them know, to the top of the tragus, that top of that little bump on the ear. So we want to line that up. If you find that it's not in the right place, we have to go back over onto this panel and lift or lower our patient's entire head to get that line straight. So we're going to lower our patient a little bit, get her chin down, readjust the line. That's about where we want it. Bottom of the orbital socket to the top of the tragus. So you'd lift or lower the patient's head. That's step number 8. Step number 9 is lining up our third line with the teeth. We're going to use this side knob on the side of the machine. And this will move my patient's chin back and forth. So we're going to get our patient to give us a great big smile so we can see her teeth. And we want to line that line up right here with the cuspid. Kind of to from the mesial to kind of the central area of that cuspid. So just using this knob at the side moves our patient back and forth. You can see that it does that. So that's step number 9. Step number 10 is about stabilizing our patient in the head holder. So once we have our patient set up in the machine, we've made sure that all 3 lines are lined up properly through the center, the Frankfurt plane, the one down the side of the face. Then we're going to take this button and we're going to put this headrest back as far as it'll go so it's resting against our patient's head. Then we're going to take the side button and we're going to tighten the sides. They may not go all the way in. As long as they're touching the patient's head and stabilizing them, we know that our patient is stable in the pan machine and they can't move. That's step number 10. Step number 11 is setting up the machine. With this button down here on the panel, this shows us the different size of patient that we may have in the machine. By pressing it, it goes to each one. The large button is for a very large framed person, usually a man. Some women are very tall, have very big bones as well, so you would use the large button for somebody that's probably over 6 feet tall and is quite a dense bone mass. The pedo is for children, usually children under the age of 10. The small is for basically teenagers or a very small female. The medium is for an average person, an average size male or female. We can use the medium size setup for. So for our patient today, we're going to use this on a small setting because our patient is more a smaller frame type female. Step number 12 is pressing the button. Now that we have our patient set up in the Panorex machine, we're going to tell our patient to close their eyes, stand very, very still, swallow, and put their tongue to the roof of the mouth. Once the patient is standing in there and stable, we're going to press the start button. So we have our patient all set up and we're going to press the button. We're going to tell our patient, close their eyes, and we're ready to go. We've given all of our instructions. So we're going to press the button and hold the button down. We're not going to let the button go. As we press the button, we're going to say exposing to let people know that radiation exposure is happening. It will go all the way around the patient. We want the patient to hold very, very still until there's no movement of the machine. Notice that the film is coming out the back end. Once it's finished moving, I can let the button go. I'm now going to ask my patient to back away from the machine. She's going to step straight back. I'm then going to remove the lead apron and I'm going to clean the machine. So now that my patient is out of my Panorex machine, I'm going to take off the barrier and I'm going to throw it in the garbage. I'm going to completely wipe down the machine, the handles, where their lips were and their face, their forehead. I'm going to wipe everything. Do not wipe the mirror. It just makes it go streaky. I just have to wipe the areas that my patient touched. After I've wiped down my machine, I'm again going to press my reset button. And it's going to come all the way back around. Once the machine comes around, then I'm going to take my film out. And I'll go process my film.